Welcome to the Colorado Business Roundtable briefing with our special guest from the Attorney General's office, the Attorney General himself for the state of Colorado, Phil Weiser, Heidi Williams from his office, and also Kurt Morrison. And we're so pleased that they were able to join us. I'll give some introductions for them first and then let you know who else is joining us that are partners for Colorado Business Roundtable. And just for folks who might not know, Colorado Business Roundtable is a pro-business public policy organization that represents some of Colorado's largest employers. We're unapologetically pro-business, and we really understand that there's an interconnectivity to the business world. It's not just about business, it's about the employees that we hire and provide jobs and benefits to every day, and the communities that we care for in areas where we work and live. So we really believe in that shared interconnectivity is the importance that business brings to Colorado. So welcome. First I want to, I'll probably do introductions first and then I'll turn it over to the Attorney General for remarks. But first I'll start off with Jonathan Coors, and Jonathan, maybe you wave your hand. I'm excited to welcome Jonathan Coors to the call. He's the Co-Chief Executive Officer of CoorsTek and Chief Executive Officer of CoorsTek Medical. Jonathan began his career with CoorsTek in 1999 and has served in a variety of roles, including sales, marketing, operations, as well as governmental affairs. He's had multiple leadership roles in several CoorsTek divisions, including CoorsTek Armor Solutions. Jonathan expanded his role within the enterprise, becoming CEO of the Medical and Semiconductors Group for CoorsTek. And in February 2016, he became the co-CEO of CoorsTek, Inc. So welcome, Jonathan. So glad you're here, helping us represent the private sector.
Thank you for having me.
Thank you. Next, I want to welcome Dr. Christopher Johnston, who's joining us today. Glad to have him here as well. One of our partners is Centura. They're an important partner for COBRT as well. Dr. Johnston is an emergency medical physician and medical director working at several Centura hospitals. He sits on the Centura Opioid Response Team, which has spearheaded several initiatives throughout our health system aimed at fighting the opioid epidemic, of which he's happy to discuss with us. He's also president-elect for the Colorado chapter of the American College of Emergency Physicians. So pleased to have Dr. Johnston on the call. When he heard about the topic specifically, he was really eager to join the conversation. So welcome, Dr. Johnston.
Thanks for having me.
Let's see, Kurt, as I mentioned, I don't have your bio. Folks can see you. Tell us who you are before we introduce Heidi.
Good afternoon, everyone. So my name is Kurt Morrison, and I manage public policy for the Attorney General and have been with him for the last year and a half for legislative affairs and public policy. It's been in my for several roles in this moment. I'm very happy to be with all of you today. Yes.
Perfect. Welcome. We're glad that you could join us. Next, I want to introduce Heidi Williams. Heidi and I have been friends for quite some time, and so I'm really excited to see her in this role, making such a difference for the state of Colorado. She's a Colorado native and grew up in Brighton. Heidi and her husband, Toby, have 3 children, Michael, Chloe, and Noah. And she's currently the director of Opioid Response for the Colorado Attorney General and is the former mayor of Thornton. She also serves as board president for Ralston House Child Advocacy Center and is on the board of directors for Front Range Community College Foundation. And to support her children, she is the vice chair of the Valley District Executive Committee for Boy Scouts of America. So welcome, Heidi. All right. And now the person you're really, that's really exciting to meet and probably very, very busy, and we're honored to get to know him and hear a briefing directly from Colorado's Attorney General, Phil Weiser. As the state's Chief Legal Officer, Attorney General Weiser is committed to protecting the people of Colorado and building an innovative and collaborative organization that will address a wide range of statewide challenges, from addressing the opioid epidemic to reforming our criminal justice system to protecting our land, air, and water. Attorney General Weiser has dedicated his life to the law, justice, and public service. Before running for office, Weiser served as the Hatfield Professor of Law and the Dean of the University Colorado Law School, where he founded the Silicon Flatiron Center for Law, Technology, and Entrepreneurship, and co-chaired the Colorado Innovation Council. If you might not know about Colorado's Attorney General, it's one of 4 independently elected statewide offices in Colorado and was established by the state constitution upon statehood in 1876. And we'll add a lot of wonderful other pieces to his bio and quite a large job that he holds as Attorney General. But I want to hand it over to Attorney General Phil Weiser for remarks with us today, specifically around opioid response and anything else that you'd like to share with us. So thank you.
No, thank you, Debbie. I want to start by just saying I also am unabashedly pro-business and pro-responsible business. And part of what I want to underscore is we see this in different situations. So, for example, we're talking a lot about police accountability right now. No one hates a bad cop more than a good cop. The bad apples are threatening trust, threatening what our society depends on, which is that people who are undermining the rules need to be held accountable. And with respect to business, I have much the same philosophy. We have great businesses in our state. We have great business leaders serving their consumers responsibly. And yes, we do have some who will occasionally cut corners or engage in behavior that is deceptive. And it's really important to hold them accountable. And so we can build trust and people can know they're protected. And during this coronavirus situation, we're seeing this because there's certain folks who will come in and say, oh, I've got this great test, it's FDA approved, except it's not FDA approved. And that type of behavior, taking advantage of people, it's not okay. And what we want to make sure we're able to do is lift the responsible businesses up, support the overall business environment, and be a part of helping support consumers so they are protected, so they can trust, and so that we encourage the ethical and responsible behavior that our state is known for. I want to talk about the opiate epidemic because it obviously has so many different elements. I'll start with the thread that I've just been on, which is we've got a number of great companies in our healthcare space who are mission-driven, really doing amazing work. We've seen that during this coronavirus time. We also know there are companies out there like Purdue Pharma who were absolutely lying, I don't use that word lightly, making money off of people who were desperate and basically saying, I'm not going to worry about the consequences. And that's not okay. It's not okay to tell doctors, I want you to push out this opioid, telling the doctors, don't worry about it being, let's say, creating dependencies or addiction. And in fact, if you read our complaint against Purdue Pharma, the company, identified those doctors who were being sanctioned even by our state for abusive practices and encouraged them to do more of pushing out what we now absolutely know are dangerous drugs. And so we're about holding Purdue Pharma accountable, holding the owners of Purdue Pharma accountable, the Sackler family, and that's going to be how we help deliver justice to the people of Colorado. And part of what's going to come from this is actually money that will come from this and other litigation. And this is going to create an extraordinary opportunity. It's probably a once-in-a-generation opportunity. One of the biggest challenges in government is too often we don't have money to make investments. So unlike businesses who are much sometimes better situated to see opportunity, to see challenges and say we need to invest to meet them, in government we sometimes find ourselves stuck with a legacy way of doing business. We see an opportunity to improve it, but we can't make those investments. And I can talk a little bit about the challenges around pretrial reform, which to me is a powerful and painful case in point. But because this is coming from a financial settlement with these companies, we're going to have the ability to work across our state to catalyze change in how we approach this opiate epidemic. And to underscore how devastating it is, when I went to the San Luis Valley during the campaign, I talked to business leaders, community leaders, and I say, how do we help build a great environment here for the future of the Valley? And they said, before we talk about business opportunities, before we talk about education, we got to talk about the opioid epidemic. Because for them, it is crushing lives, families, communities. People who are not able to work because of their addiction. In their jail, by the way, 90% of the people there are addicted to opioids. And the sheriff says, I can't help them. He doesn't have the resources or capabilities. To me, that's a travesty that we are not able to deal with and address this crisis. And so when we get this money, we're going to look at solutions across the board. First, we do have to do better on education and prevention, and I want to partner with employers. We'll get to that in a minute. Second, we've got to work hard on drug treatment programs. We have about 30% of what we need in our state. And finally, recovery programs, things like sober living or other ways people who have come through treatment can stay on the right path. And we'll get to Heidi in a minute. She's spearheading our effort to learn best practice in these areas, to build partnerships and relationships so that we can move the needle and change the paradigm. Because right now, a lot of times the criminal justice system is where we end up dealing with these situations because people hit bottom and then they're in jail going through withdrawal, often a very painful experience. And then when they leave, by the way, they're 100 times more likely to overdose than other people who are dependent on opioids, which is a major challenge. And we've got to do better. And only together are we going to come up with solutions. And that's something that I invite all of you to be a part of. I'm so glad we have Dr. Johnston here. My final note is going to be on this pretrial point as an example of how we can catalyze investments in a smart way. Right now, if you're poor and you're arrested for any reason, for example, you're addicted to opioids and you buy heroin, you go to jail. And you stay in jail unless you're able to pay cash bail. And that's something which is really important because 50% or more can't pull together money for these expenses, so they stay in jail. If we could create a new system, which is, let's say, risk assessment, are you a risk to actually hurt people, to flee, we could keep less people in jail, we could monitor people out of jail, that would save money, that would help people stay employed if they have a job, stay with their family. It's a better model. And so we have to work to change our model to help support people. There's a lot that employers can do as we partner, including their own employee assistance program. So that's where I'll stop on this. I could go on and answer questions. I know Heidi's got some valuable feedback here to add, and then I look forward to your questions and thoughts.
Thank you so much. Now we'll hear from Heidi. Take it away.
Thank you so much, Debbie, and thanks, AG. I do like seeing your kids in the background. It's good. It's not just me that it's happening to. So I'm a former business owner. I owned a business from 2004 to roughly 2012. Before I owned that business, I worked for another company, and we had an employee that had a heroin addiction, and we actually, probably not legally, we didn't know what we were doing. We were trying to help the guy. We let him stay in our warehouse, and he, once we realized he was homeless, and I didn't know anything about how to help him, what to do, other than to just make sure he had a place to stay that was warm. If I knew then what I know now, we would have been a much better employer to him, and we would have kept him. This guy was very brilliant. He had a degree in economics, and he was a great employee until he used, right? And so that is probably my first experience with someone who has an addiction, but over the course of time, I've really become passionate about this. I was doing a little research for this call because I know for businesses, one of the most important things is the bottom line. And from 2014 to 2018, healthcare has been affected by this at the tune of $205 billion. Premature mortality, $250 billion. Lost productivity, $96 billion. Criminal justice activities, $39 billion. And then child and family assistance and education, another $39 billion. That's across the United States. Those are staggering figures. And I think that there's a lot of ways that, the business community can work together and partner with folks like us who are just trying to help folks and figure out how do we support our employees. The U.S. Surgeon General at a conference I was at in January or February was talking about an employer in his community that actually will put somebody through treatment and support them throughout recovery and keep their job as long as they're doing what they're supposed to be doing, and that business is supporting them. And that's a big company. It's not something that everybody would be able to do, but I think there are some opportunities for our businesses to really engage in this issue and to continue to work together. So I look forward to having those conversations with you all as we move forward and as we receive settlement funds to figure out some innovative ways. I mean, that's what Colorado does. We are innovative, and we might be the wild, wild west, but we get things done. And I think that it'll be really exciting to work with you all on that. So I look forward to your questions.
Great. Thank you, Heidi. And it's been really interesting to already start brainstorming on how the private sector could help be a piece of the solution through your office and through the Attorney General's work. And so we're excited to bring our partners to the table as well, not only just today, but, going forward. And I think, most employers would agree workforce is critical. Without healthy, talented people willing to jump into the business world, you can't meet any other objectives. So appreciate your time. I want to open it up. Perhaps we'll start with Dr. Johnston with any remarks or questions, and then we'll ask Jonathan what questions he might have for the Attorney General. And this portion we'll just have kind of a conversation, kind of that Q&A, and then for the folks just listening in, we're going to open it up to you all in about 10 minutes to see what other questions we have. So Dr. Johnston?
Yeah, no, I think just real quick, kind of outlining what we're doing at Centura and kind of the medical response to this opioid epidemic. We're, have a very well-made paradigm that we're actually using, and it's built on the foundation of the fact that opioid use disorder is not a moral failure. It is brain failure, and we can approach this in the same way we approach any organ when it fails. And there's, 4 pillars for us at Centura. We're, the first pillar, we want to decrease the use of opiates we use in medicine. That's, just our prescribing lengths, utilizing the PDMP, which, I think is a great topic with regards to policy and legislation. For us, mandating use versus maybe making it easier to use is part of the conversation because it's a little cumbersome currently. The second pillar is alternative to opiates. So there's plenty of pain medications that are well studied, work in acute non-cancer pain, and we can put those at the forefront of treating pain, especially when it comes to us in the emergency department. And at Centura, we're actually rolling out a pilot on the inpatient side. System-wide, we had a great Alto project for us in the emergency department. And over the last 2 years, we've successfully decreased our opioid utilization 20% and increased Alto, which is alternative to opioid utilization, by 16%. So some big wins there. The third is just kind of the overall discussion around harm reduction. For us, we're just getting ready to roll out a naloxone program so that every ER in Centura has naloxone take-home kits that we can give to patients that have screened as high, risk for a potential opioid overdose, because you can't recover if you're dead. And the Attorney General mentioned, these very high risk times coming out of jail, relapsing. That's when these patients and individuals suffering from opioid use disorder, they'll use the same amount that they used back when they had built up a tolerance, and unfortunately that kills them. And then finally, and one of the more exciting parts of this is medical assisted therapy, or MAT. And for us in the ER, we use buprenorphine, and it's kind of part of where we can maybe take this conversation too. So if patients come to us suffering from opioid withdrawal, we're now able to screen them and get them started on buprenorphine in our emergency departments. Part of where the gaps are is our community partners that we can then refer them to from the emergency department to take the reins and continue their treatment. There is an X waiver that is tied to the ability to write a prescription. Luckily for us in the emergency department, we fall under something called the 3-day rule. So we can just give buprenorphine in the emergency department, but more and more, and as I discussed, this is, a organ failure. It's routine medical practice. And, personally, that X waiver is just a little bit of an antiquated thing from the war on drugs, way back when, saying, and this understanding and confusion around, wait, you're going to use an opioid to treat opioid use disorder? And the answer is, well, yes, absolutely. The pharmacology and the way that this drug works is actually perfect. And we've been able to get a lot of our patients back to living normal lives and being productive members of society. So that's a little bit of the work that we're doing within Centura and as ER doctors. So happy to be part of this conversation. Thanks for having me.
Thank you. Dr. Johnston, did you have any specific recommendations or questions for the Attorney General or for Heidi on the topic? Or did you want to just sort of feedback as far as the Centura perspective?
Yeah, no, I think just, what we can do as community partners and hospitals for you is a great place to start. And then also, I think for us legislatively and some of the policy recommendations that we've made either from Colorado ACEP or within Centura are just addressing a lot of those barriers from either the inpatient side to the outpatient realm, these having a place to actually, take care of these patients. Those are lacking right now in Colorado. And then, I think for us medically, PDMP is kind of a hot topic and how that gets utilized. And I think how you legislate it, and where do you put the onus? Is it on our electronic medical records to make it easy to use? I'd argue, most physicians love the PDMP. It gives us a real-time update. And that goes into even more for us and Centura and all the hospitals within Colorado. It's just so hard to talk to one another. I can be working at St. Anthony's North in Thornton, and a patient could have been discharged an hour before from North Suburban, and I'll have no idea. And there's a lot of great work that's been done in Washington, and we're trying to get some programs going here, some of them through the private sector, to develop what are called emergency department information exchanges, which is it pushes the information to us, whether that's a patient, that might have some red flags regarding opioid use disorder, doctor shopping, having a lot of that, and all the way to, violent patient behavior, all that stuff that we are kind of flying blind right now because none of the electronic medical records talk to each other. So just, a couple seeds to plant that would, I'm sure we could talk forever about, but those are a couple of the main points.
Thank you. Any response on some of that or clarification? Heidi or?
Yeah, I was just wondering about the emergency room information exchange. Is that being done in Washington? Is that the state that I could look at?
Yeah, they adopted it. I don't know if you're aware of Choreo here in Colorado, and there's now a Colorado Connect. So the work is being done through some, of the private groups as they're figuring that out. It's just now needs to become, find ways that we as health systems can easily adopt this and find, either the funds or how does that get supported? Because if we can all jump on some safe system and, even better yet, push it to me when a patient registers, it pings HIPAA protected, database that then if there's an issue or red flag specifically around opioid use, it pushes the information for me. Because right now going to pull it from something like a PDMP is real cumbersome, and on a busy ER shift can really put you behind.
Thank you. I appreciate that.
And for folks on the call, somebody asked, what's a PDMT? Heidi answered, prescription drug management program for us civilians. So appreciate that. Jonathan, I don't know if you have any questions regarding opioid in particular, or any questions regarding workforce or the private sector, but wanted to open it up to you as well. You're still on mute. Oh.
Yeah, oh, go ahead.
I was going to say, Attorney General Weiser had a comment. He kept muting and unmuting himself, so I was going to defer the floor to him real quick.
No, I was going to get in, but you go first, then I'll go, Jonathan.
Okay, thank you. I guess one just quick comment. CoorsTek, we are locally based here in Colorado. We have about 1,000 employees. We're all over the United States, internationally as well. And I think our view on this kind of conversation is really stems from one of our values, which is we value the inherent worth and dignity of every individual. And I think there's a calling here around a crisis like this, an opioid epidemic, to how can employers partner, responsible employers, to use Attorney General Weiser's, with local community organizations to help do workforce development for folks who are really trying to move out of a past life into a new life. And so we have in the past, from time to time, partner with local groups like Activate Workforce Solutions here in Denver. I would be interested to know from Attorney General Weiser and Ms. Williams, like, as you think about the use of this fund, what are your thoughts around allocating a portion of that resource towards workforce development, kind of a second chance program, as it will? So because Admittedly, our unique challenges is we're operating on heavy machinery, so there is sort of a level, but that's unique to us. But really, philosophically, how you see the use of those funds going towards partnering with organizations like CoorsTek, coming together to be a place where future employees can come to work. So I think that's kind of my burden on something like this, is we feel the calling and the responsibility as an employer, but that the folks that work for us are amazing and we value who they are and want to see them succeed. And I think a program and a partnership with the state to help enhance that for folks who are really trying to move forward in their lives is something we would get behind for sure. So I'll leave it at that.
I love that, Jonathan. Let me start with that, then I'll get back to what I was going to say to Dr. Johnston, which is we're thinking both about people who've been incarcerated and drug users who had substance abuse disorder with sort of a second chance mindset and trying to develop that partnership. And so we'll be able to identify people who've gone through drug treatment and recovery programs, and having employers who are positioned to give people that opportunity, that's huge. Because a lot of times you need that job, whether you're in the criminal justice system, whether you're coming over struggling with addiction or both, the job is critical. And having employers with the compassion and with the mindset of, you know what, we see someone here who could be a great part of our team, we're going to give them a chance, that's extraordinary. So I'd love to help develop a coalition of such employers, and Heidi can follow up with you, Jonathan, and others. That would be awesome. So very excited about that. And then Dr. Johnston, I think your point about MAT is really important because we're not using it enough in enough places. And notably, jails are a huge opportunity, and one of our goals is to scale up use of MAT in jails. I don't know if that's on your radar screen at all, but Heidi can talk more about that as well.
Yeah, no, I think, there's even a telemedicine conversation. I think the coronavirus has really jump-started our abilities within telemedicine. I know there's even right now a bill that's being, going through the legislature to help support us in our ability to do that. And I think that will be pivotal. You will see, deaths out of jail plummet if these patients who, have been identified and suffer from opioid use disorder are put on a medication to treat it. And, once we can get this idea that buprenorphine is to opioid use disorder as insulin is to diabetes, then great, we can melt away the X waiver and, we can let the buprenorphine, get to where it needs to go, because it is truly a remarkable medication. I mean, not to get too much into the science of the weeds, but it does everything you need with dealing with the cravings, but it is not, has a dose curve where you can't take too much. It levels out at halfway. And so, personally, the patients that I've gotten started on, it's just great to have some of the stories from those that are even on it in the emergency department say, I am back to work. I am back to spending time with my family, and are no longer doing those behaviors that were fueled by the addiction and just, an utter fear of withdrawal. Because that's the drive. It's just, it doesn't come from a place after even a few weeks of euphoria. It is merely just trying to prevent withdrawal. And so, things like removing the X waiver, I think, is something that we can really start talking about, as it is a big barrier. I mean, for us as physicians, it's 8 hours of training. If you're a PA or nurse practitioner, it's 24 hours of additional training of something that, as I said, should just be rote to our practice. But no, jail specifically, and I think a robust, telemedicine platform that you can get physicians, clinicians into these jails. It isn't too complex in order to prescribe buprenorphine, and that's part of the argument I'm making to my clinical colleagues. It's just how easy this is, and it's something that we can just really easily dovetail and are dovetailing into our practice.
Thank you. I had another question come in via email to the Attorney General or to Heidi. And for the folks on the call, if you have a question, I think the way I'm going to frame it, because we've only got about 10 minutes left, give or take. If you have a question, put it in the chat, and then I will definitely unmute you and add you to the panel so you can pop on. That might be an easier way than throwing in another whole batch of folks to the call. So this was a question sent in by Margaret, and it really talks about her question is about, seems like the opioid crisis has two components, one of supply, one of demand. And she's curious, I think, number one, who are the suppliers? Is it mostly medical professionals? Is it, you think about, she put drug cartels, individuals, who are the suppliers traditionally? And then who are the users? Not to necessarily get into stereotyping, but we talked about rural Colorado being a hot pocket. It's probably people like, it could be my next door neighbor who got hooked on opioids from a back surgery, for example. So I think she's curious about the suppliers and users, and if you have any light to shed on that.
Let me start, and then Heidi can follow up. First, a remarkable percentage, Heidi will know the exact number, of people who are heroin users start with pills. And that is a painful point, which underlies some of the litigation we're now in. We also would note that the pills can come through, as you know, legitimate or illegitimate. So the legitimate would be the back surgery situation, which we saw this. OxyContin was marketed, encouraged. I remember breaking my ribs several years ago, and I got like a 3-month supply. And that was way more than I needed. I didn't take a single pill. Now, I kept in my medicine cabinet. My wife's a doctor, actually expert in this area. She disposed of it all properly. But imagine if that was sitting there for my teenage kids to then discover and think it was a party drug. That's the second thing that happens, which is kids get access to it often in their parents' medicine cabinet. And then sometimes kids will start trying to buy in the black market. And a friend of mine lost her son, who bought what he thought was OxyContin. It was labeled OxyContin, but it was actually fentanyl, and he overdosed. And then obviously, as I foreshadowed, a lot of people find it easier to get heroin than the pills, so they will segue from one to the other. You're right, there's more of an incidence in some of their rural areas, hard-hit areas. If you look at our maps, you'll see sort of the red spots, but it is all over our state with all demographics at all ages. So it depends on a lot of factors. It's not something that you can easily predict. There are obviously fentanyl and heroin suppliers. We are going after them as well, drug cartels. That is a part of our strategy, but we have a multi-pronged strategy. We try to do exactly what Dr. Johnston's talking about, which is more responsible prescribing is super important to this challenge. Education, prevention up front, getting people to be aware of the risks. That's why things like drug take-back days are very important, the way we can work together. Getting people treatment when they are addicted, the sooner the better, because they can, again, preserve more of their lives. A lot of times people are afraid to admit they're struggling with an addiction. And then, obviously, we're going after the cartels and even the neighbors from pharmaceutical companies who've pushed it, and we're working to change their practices as well. Heidi, what would you add to that?
To your other point, 85% of people who use heroin report starting with the pill form, whether it's prescribed or not prescribed, and so that's kind of the supply. There's a great book on supply and demand if anybody wants to read it. I don't know if he would have advertised it like this, but Dreamland really talks about who, pharma, big pharma, specifically Purdue, and then the young kids from Mexico who were basically solicited to come in and push the black tar heroin. It's a really good book, and I would recommend that.
Great. I want to open it up too. I don't know if Jonathan or Dr. Johnston have other questions, but I think folks on the call might have some, it sounded like you were open to answering questions of subjects that are on your plate. And I'd love to kick that off. And I know we've got a hard stop at 2:45 for you to be respectful of your time, but what's top of mind for you? I mean, it sounds like any plan that your office might have had in January 2020, even on this important topic, there's so much now on the plate in terms of the pandemic, the global health crisis, of course, the corresponding economic crisis, which we spend a lot of time on. There's a lot of issues circulating in Colorado, and while we've got you on the line, curious about what's top of mind for you, and what would you like the business community to know or to be helpful for you on that subject?
It is interesting because when I took office, when I talked about the crisis, I was generally talking about the opioid crisis. Now when I talk about the crisis, I have to be much more specific because we're dealing with a public health crisis, we're dealing with an economic crisis, and now we're dealing with a justice crisis as well. So the business community, I believe, can be an incredible partner on whatever fronts work for you. You know, Molson Coors, for example, on issues around diversity and racial justice, was just honored by the Colorado Hispanic Bar Association for their commitment. And a number of companies are real leaders on diversity and inclusion, and we want to partner with you on those fronts. We want to partner with fronts on economic help. We're going to be standing up an initiative, actually, as it turns out, with the former general counsel of Molson Coors, to provide support for small businesses who are struggling, who need advocates as they're dealing with challenges during this time. We're obviously working hard on the public health front to protect people and get the word out about how we have to manage during this time of COVID. And while we're here, the opioid epidemic. So we view the business community as partners to work with us on solving problems. Depending on where your company is at in terms of your interests, please engage with us. Heidi or Kurt can both help people get engaged. I love Jonathan's point about employer commitments to being a second chance employer for people with addiction and or criminal records. That's super important. Others may say, yes, I want to help on diversity and inclusion because we need to do better on that front. Others may say, we want to work with you on how we better, you know, educate consumers so they don't get defrauded, particularly older adults. And that's my message, is this is a team sport, making our system of government work, and we're better when we're in this together.
Yeah, well said. I think we're in challenging times, and we're going to have to figure out how to handle multiple challenges at the same time, whether you're in the private sector as a business owner, what you're handling in terms of justice for the entire state. With that, I want to open it back up. I don't know that I see any questions from the folks on the call. If you've got one, send me a note. Anything else from Jonathan? Kurt, did you want to weigh in? Any other feedback today for our Attorney General? Look like Jonathan.
Sorry,
there
we go. I have like my headphones and this, and so somehow but it's right. Sorry, time killer. I think the question that is top of mind for many business owners is, so a lot of our employees rely on the education system and after school programs, and a lot of these nonprofits that engage to help with employees to be able to go to work. I'm just curious, like, as we move through the summer and start thinking about the fall, what's the current view from you or from the governor's office around school? Obviously, it's like, listen, this is a tough conversation, but I just would be remiss if I didn't use this opportunity to ask that kind of question.
I'm going to start with the piece that I am most directly involved with and then get to the harder question. My first view is, if we don't have enough access to broadband devices and broadband, the people who are most vulnerable are going to fall further behind as we rely on online schooling. And that issue is one that's very important to me. And if any of you are thinking about this issue, the digital divide issues, be in touch with Kurt and I. We're going to be looking at this. It's already been a damaging situation for people who have to do remote learning and who are not equipped to do it. I worry to the extent next year we have more of that. Your question is the big one, and the governor is going to have to think long and hard about how we play it. It may be different in different school districts, different parts of the state. I don't have a real good answer for you. I too am waiting and watching. I think CU did something very clever in how they structured their return to school next year. To the extent school districts can follow that model, which is going to be an innovative model, it will prove to be more resilient. I think it's going to be valuable. But the honest answer, John, is we don't know.
Okay. And with that,
maybe a quick follow-up. One quick follow-up. So to that, I mean, there's like, I think within the business community and business leaders, there's a ton of energy to help support thinking through that. What is, on this specific topic, what's the best channel besides the email address on the public-facing website that we might be able to support you all as you think through this? And if you want to take that offline, that would be a useful question, I think.
Heidi, can you share your...
That'd be helpful.
Heidi's going to share her information in the chat box. Any of you who want to engage on any issue, just be in touch with Heidi, and she'll make sure you get to the right place. Thank you.
And if we end up turning off the chat, feel free to reach out to me and I'll connect you to Heidi. So if the number goes away too quickly. Well, perfect. Thank you so much, Attorney General Weiser and Heidi Williams and Kurt Morrison for joining us from the Attorney General's office today. Appreciate all that you do for the state of Colorado and know that your job is incredibly challenging. And I want to thank Jonathan Coors and Dr. Christopher Johnston for joining us from the private sector in Colorado as we're trying to be partners, and all of our businesses with the Colorado Business Roundtable, count on us to be private sector partners for you as you continue your good work. So thank you all for joining us today.
Thank you, Debbie. Really appreciate it.
Thank you.
Thank you.
Thanks now.